If you're starting dental school soon, you're about to make one of the first investments of your dental career, and most people walk into it almost knowing nothing. I'm talking about dental loupes. The right pair protects your neck and back for the next 30 years and makes your clinical work better, which means higher grades for you in your preclinical and clinical courses. The wrong pair gives you headaches, slips down your nose all day, or sits in a drawer after spending thousands on them because you hate wearing them, and then your clinical work and grades suffer. So in this video, I'm gonna walk you through everything: magnification, the different styles, ergonomics, lights, and at the end, I'll give you a secret on how to get the best deal on loupes as a dental student, which can save you hundreds of dollars, if not $1,000. If you're new here, I'm Dr. Andrew. I'm a dentist who is passionate about helping pre-dentals and dental students. And let's dive into talking about making the right decision when you get your dental loupes. So the first and probably most important decision that you'll have to make when buying loupes is magnification. How zoomed in do you want the telescopes attached to the glasses to be? You'll see magnification levels like 2.5x, 3x, 3.5x, all the way up to 5x and beyond. Throughout dental school, I personally used 3.5x magnification loupes, and I thought they were the perfect balance between seeing the details of teeth clearly and up close and still having a wide field of view, and also being able to get used to the telescopes and not have them hold me back from wearing those loupes often. And that's what I'd recommend as a D1 dental student. 3.5x or 3x is the perfect magnification for the vast majority of new dental students who are wearing loupes for the first time. I would not recommend going below 3x magnification, and here's the honest trade-off with higher magnification. As you go up in magnification, you get a narrower and narrower field of view, which can feel like you're kind of getting tunnel visioned or just seeing less of the arch. When you're still developing your hand skills and getting used to that narrower field of view, and it definitely requires some getting used to, I'd probably stick with not going too intense with your magnification, and that 3x or 3.5x is going to be that perfect middle ground for you. And my favorite loupes with the 3.5x magnification are going to be the Designs Provision 3.5x magnification loupes with their Infinity View system. Their Infinity View system is going to make it so you not only see very clearly and in depth, but also get a wider field of view. And once you get used to that 3x or 3.5x magnification, and you're getting to graduating dental school, you can then go to a 4x or 4.5x magnification. But starting at that high of a level of magnification is probably going to be overkill and pretty difficult to get used to. So ultimately, go with Designs Provision. Start with 3x or 3.5x magnification. I highly recommend their Infinity View or panoramic system, which is going to broaden that field of view for you. And then later on, switch to a higher magnification once you're graduating dental school. The second big decision you have to make when buying loupes is whether you're going to go with an ergonomic or traditional design. This is what the traditional design looks like and requires looking down like this to get the perfect image in the loupes. And this is what the ergonomic design looks like, and I can just look almost straight ahead like this to get that perfect image in the loupes. So the ergonomic designs essentially make it so you do not need to move your neck or back down anywhere close to as much as a traditional design. The ergonomic or ergo loupes are the newest and hottest thing in the loupes world. Traditional loupes require you to tilt your head and neck down to look through them way more, but ergonomic loupes make it so you can keep your head nearly upright and straight with better posture while looking down into the patient's mouth. So ergonomic loupes are probably the best things for decreasing back and neck pain. But the issue is a lot of ergonomic loupes have issues with image distortion when you're looking through them. But the Designs Provision loupes actually have a really unique patented design where the distortion that other ergonomic loupes usually suffer from actually gets resolved by using proprietary stuff that kind of goes beyond my level of understanding, but essentially it's using base prisms to collimate the images of the two telescopes instead of what other loupe companies do, which is usually turning the barrels of the telescopes inwards or rotating the telescope barrels to collimate the images. And either of those methods really just induce distortion because the image is being rotated unnaturally. And the reason why you should care about that is because that presents itself to you when you're wearing those loupes as eye strain, headaches, and difficulty in getting used to and adjusting to those ergonomic style of loupes. So more kudos to Designs for Vision for finding a way to get rid of that distortion and making these ergonomic loops so great. So Designs for Vision took care of that, but there are frankly two other downsides in general that you're going to want to think about when getting ergonomic loops. And one is going to be that they cost more, and two is that they are usually a little heavier than traditional loops. But I think preserving your neck, back, and health is well worth the little bit of a greater investment into ergonomic loops. And I actually weighed my old traditional loops from a different brand, and they were actually heavier than the ergonomic loops that I now have with Designs for Vision. So with Designs for Vision, you get the best of both worlds. Lighter loops that also preserve your back and neck. It's the ultimate win-win. And I'll address why weight matters so much real quick. You're gonna be wearing these all day, or at least for many, many hours at a time when you're in sim lab or in clinic all day. And wearing heavy loops for hours at a time is gonna kind of put a strain on you and get to be quite uncomfortable. So the lighter you can get, the more comfortable things are gonna be. And I think the Designs for Vision loops meet that perfect balance again, where they are both light, ergonomic, and comfortable. And just to keep things objective, my Designs for Vision ergonomic loops came out at just 3.2 ounces and are very comfortable. The third thing you'll have to decide when it comes to buying loops is gonna be the style. It's essentially design. This is ultimately totally up to you, but loops don't come in like a one-size-fits-all frame. They can work with prescriptions, and you can choose what style of frame you want, whether it's the actual design of the style or even the exact color of the style. So there are gonna be designs that are like traditional glasses, kind of like these, and there's also gonna be ones that are quite sporty and kind of like everything in between. Essentially, you get to choose the design of the frames and also the color. There are things like pink, blue, gray, black. It's all out there. You get to have some fun with that and kind of make it your own. The other kind of cool thing is that Designs for Vision will actually engrave your name onto the frames. It's kind of cool and feels good to have that, but it actually serves a purpose, because whether you're in a dental clinic or just in the sim lab, there are gonna be times where you take off your loops, and the last thing you want to do is lose something that you've invested thousands of dollars into. If you're finding this video helpful, give it a like and subscribe for more helpful pre-dental and dental videos. And let's dive into number 4 for the decision you're gonna have to make, and that's gonna be about your light. Lights for loops are a must. When I was a D1, some of my classmates didn't buy lights with their loops and instead waited to buy off-brand lights that were cheaper rather than buying the lights from the Loupes companies. While those lights that they bought were cheaper, a lot of my classmates that went that route had issues with lights fitting properly on their specific loops, the lights not getting bright enough, or just not lasting long enough and going out quickly in the middle of a procedure. I never had any of those issues. I'm a big fan of buy once, cry once, even if that means spending a little bit more, but getting quality things that are gonna last and really do their job right. And that's exactly what investing into a high quality light is. So that's what I would recommend. And my friends who bought the cheaper lights ended up buying new lights from the Loupes companies later on during dental school. So that cost them even more money than if they just bought those higher quality Loupe lights to begin with. And then they wouldn't have had to deal with the hassle and the frustrations and the stress and all that stuff. So I recommend just buying the thing that works right the first time. And the second thing you're gonna have to decide is, do you want one light or one battery or two batteries to power the light? And my recommendation is to buy a backup battery pack from day one and always have that backup battery fully charged. So in case you experience a dead battery or it goes out in the middle of a treatment, it doesn't cost you time in a sim lab, a clinic session, or ever compromises your work. The third decision you're gonna have to make about lights is gonna be whether you wanna go wireless or wired with your light. The benefit of wired lights is that they typically last longer because they come with a bigger battery pack, and that goes into your pocket or attaches to your scrubs. And the benefit of the wireless light is that it just doesn't have a wire dangling around. I've tried other Loupe lights, but I love the Designs for Vision wireless mini light and the ultra mini light. They're both very bright, last a long time, and those are what I would recommend if you're in the market to buy a Loupe light. I promised you that I would tell you how to save hundreds of dollars when buying Loupes, and we're gonna go into that right now. So this is the key. You've watched this video, you've learned a lot about the different things that you want to factor in when buying Loupes, and you do not want to go and buy your Loupes right now directly. Instead, what I would recommend is waiting to start dental school and attending the vendor days or welcome week loop fairs, where a lot of these dental schools are going to bring in multiple loop companies like Designs for Vision. And that's going to happen usually during the first couple weeks or maybe even the first week of dental school. And during that time, you can try on different pairs of loupes. You can see what style you like, whether you want to go with the ergonomic style or the traditional style. And during that time, the representatives from these loop companies are going to take measurements like the distance between your eyes, as well as where your hands lie when you're working and kind of looking down. And they'll be able to dial in your telescopes and loupes perfectly and customize them to you so you get the perfect focused magnification at your specific working distance. And this is also when the best deals usually happen. So this is when you want to wait to buy your loupes, during these vendor fairs and things like that. And while loupes are expensive, you really do get what you pay for. And the price of a good pair of loupes can save your neck and back. If I was starting dental school again, I would for sure get the Designs for Vision ergonomic loupes with 3.5x magnification with the Infinity View system. And I'd go with either the wired or wireless light. I don't think that makes too big of a difference at the end of the day, and you really can't go wrong with either. If you have any questions about loupes, drop your comments and questions down below, and it'll help as much as I can, or at least I'll point you in the right direction.